Why am I sitting in the consultation chair in my consultation room? Because we're going to do a video on cosmetic surgery, or specifically facelift consultation. Now, the consultation process is one of the most important things, and it is the beginning of the doctor-patient relationship. And the patient is looking at the office and the staff and the doctor and trying to think if that's who they want. And the doctor and the staff are looking at the patient to make sure that that's the kind of patient that they want, somebody that's going to be compliant and doing surgery for the right reasons. It's actually kind of fun, and I really enjoy it because I get to meet new people every day and talk to them. So sometimes people are really nervous when they go to a consult, but so often people don't know what to expect. So we're going to show you an actual consult. This is a lady that came in for an actual consult. And as we were doing it, I thought, you know what? She would be a good patient if she lets me do a video to actually show people what a consult is like for deep plane facelift. And so we did it. So stick around and I'll show you how we do a deep plane facelift consultation.
And I've got a great patient today here, 62-year-old female, and we are talking about cosmetic options. And when we do this, we like to start with the lower face and neck. Okay, so that's the lower part of the face. Then the mid face, which is the cheeks. Then the upper face, which is the eyelids, and possible brow lift. And then finally, the skin. So those are kind of the four things we address. The flavor of this video is going to be, what do we look for at an evaluation for somebody that's going to be an excellent facelift candidate, okay? So obviously, one of the first things is, are they old enough and do they have enough aging for a facelift? So I do over 100 facelifts a year, and you know, our average age is about 54. Now this includes people that are 48 and people that are 85. So everybody ages differently, but usually we do really well for half century. And then once we get 50, we look in the mirror and we start seeing changes. We start to look a little bit more like our parents, and then everything starts to happen. So what do I look for in a patient? Okay, well, first of all, when I walk in the room, I have this smiley, bubbly, energetic patient. She's in good physical shape. She's healthy. So that's awesome, okay? And, you know, we really like interaction with our patients. We're not some stuck-up doctors here that are too busy to talk to patients. I really enjoy the patient experience as much as the surgical experience, and she has some great stories, okay? So when I look at somebody, now just relax and don't smile for a second. When we're young, and it's hard I have to try and do this and not block the camera, but when we're young, our face is tapered. It tapers down to our jawline. But as we age, put your chin down a little bit, as we age, it gets square, all right? So one of the big things about a deep plane face and neck lift is to get that tapered face back. And again, if we were able to look at this in time lapse from somebody that's in their 30s to their 50s, they're going to see this very slow descent, and you're going to have these jowls. The other thing is, and let's sit up just a little bit there, the other thing is we get this extra neck skin, and this is the stuff, jowls and neck skin are pretty much why people have facelifts, okay? So if I see somebody and I can go like this, all right, that's going to really improve her situation. Now, again, and I'll show you in a minute, there are some things that really help making a patient an excellent candidate for a lift. One is a good chin. And when I say a good chin, a prominent profile. People that have recessive chins, there's less room from here to here. So having a good chin projection is important. The other thing is, turn sideways a little bit, is having a nice jawline, and she has an excellent jawline. And then I'm going to show you some things about, in a couple minutes, I'm going to show you some things here about this area of the neck. So when we talk about a facelift, and I tell patients, above the jawline, a facelift's going to do that, okay, without the crinkles. Below the jawline, it's going to do that. Now, this patient has hollow cheeks. She has depressions. If we do a facelift, it's going to really improve her cheeks, but it's going to go from hollow to flat. If we really want a more youthful cheek, then we would consider doing cheek implants or filler. So it's important to tell patients a facelift is effective from here to here, okay? And it doesn't do anything in the center of your face, all right? So this patient is a candidate for deep plane face and neck lift. And as we move up to the mid-face, if that's enough cheek for her, it's enough for me. However, if she wants a more rounded, youthful cheek, we would consider cheek implants. We do a lot of those with our facelifts. Then we move up to the lower eyelid. And if she, look up at the ceiling 1 second. So she has some fat bags here. Not horrible, but enough to be done. You can look straight now. And some crinkly skin. So what we do is we take the fat out from the inside so there's no scar, and then we'll laser that skin to tighten it. On her uppers, are we relatively zoomed in here? She's a candidate for upper eyelid blepharoplasty. And if she walked into a lot of offices, people would say, yes, we can do your upper eyelids, and that's where the conversation would stop. But it's really important. Now, if you look straight ahead, this patient would really benefit from a brow lift. I think that looks great on her, and that's probably how she looked when she was younger. Now, if I do blepharoplasty, just eyelid surgery, we're just taking away this skin. It improves the eyelid complex, but it doesn't do anything for this. And this is forehead. You can't cut that off. But when you do a brow lift, okay, that takes about half of the skin excess, and then we'll remove some more skin off of her eyelid. But patients will usually tell you when they look in the mirror, and I go like this, they either love that because that makes them look open and more alert and more youthful, or they don't like it because they feel it looks unnatural. So it's important to have that communication. So I said we're talking about the lower face, which is deep plane face and neck lift, mid face, which would be either nothing or cheek implants in this case, and I count the eyelid as the middle face, so we would take some fat out, tighten that skin with a laser, and then for the upper face, we're talking about brow and forehead lift, which will also include blepharoplasty. Then finally, the skin. She likes to boat, and she's an outdoor person, very active, so she's got some sun damage, and she'd be a good laser resurfacing patient, which can be done at a separate appointment, or we do it at the same time in selected cases. So this is the basic conversation that we have. And what the patient decides to do is based on, number one, what they want to do, not what I want to do or what I talk about. I just give the patient a menu. And everybody has a different menu. And I can do this, 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 this. Some patients order the whole menu. Some people just want A and B. Most patients want to do everything at one surgery. Some patients want to do it piecemeal. Doesn't matter to me. I love coming to work. I love doing this stuff. And when I sit down to do it, I don't really care. Only thing I care about is I'm doing what the patient wants and what's good for the patient. So when a patient makes a decision about having cosmetic surgery, it should be based on, number one, what she wants, okay? Number two, which is really number one, is her health. That's the most important thing. We have to have a safe experience. Patients have to be safe. We have a fully accredited surgery center, and we have our own little hospital in the back. We have full-time anesthesia. I've got a really well-trained staff, and I only do stuff from here to here. So her safety is never in question, and we're held to the same standards as the hospital. All right, so what the patient wants, safety, okay, and then it's health, recovery, budget. So her health, that's very important. That ties into the safety. We never take chances. All of our patients for facelifts will have history and physicals and medical clearance from their physician, and again, we just don't take chances. Health, recovery, and budget. So recovery, your initial recovery for a facelift is going to be about 2 weeks. Not 2 weeks before your class reunion, right. Okay? And this is a time when most people will get out and get kind of back into things. Now, everybody's different. Some people in a week, they can comb their hair down. I don't have that option, but and wear a scarf and go to work and tell people, yeah, I had something done. If somebody had the cruise of a lifetime or a big wedding or something like that, I'd tell them to wait, 6 or 8 weeks. because recovery is just variable, and I have some really good YouTube videos on recovery. By the way, we just hit 23 million views on our YouTube video, so thank you if you're watching. Now, so this is a conversation that we have. So we're going to stop for a second, and we're going to come back, and we're going to lay the patient down. But before we do that, I just want to tell you my usual conversation. So 100% of people are worried that they're going to, look like that or look crazy. And experienced facelift surgeons and people who do a lot of this should be confident on how they can make somebody look. Now, if somebody has unrealistic expectations, then I'm probably not going to want to operate on them. We could do a reality show. Any surgeon could. People come in, they want to look like Elvis. They're 19 and they want a facelift, or sometimes they want to do it for the wrong reason. To save a marriage or think they're going to get a promotion or whatever. My best patients, and this patient, she wants to look as good as she can for 62, and that is a home run, okay? So everybody's going to say, well, what am I going to look like? Now, a lot of my colleagues do video imaging, and I actually used to market one of the first video imaging systems decades ago, and that's fine if you want to show somebody what they're going to look like after their facelift, but you know what? It's a cartoon, okay? And you can make it look any way you want. I'm going to show you something that I think is the most accurate way. And after doing 1,600 facelifts, I don't care what we're seeing right now. I'm just showing that we're going to lay this patient down, and every 5 inches we go back is going to take off a decade of aging. Okay, and so what we're going to do here now is come back and do a side view, and I'm going to show you further conversation we have on this. This is my favorite part of the consult because it really does show what people look like. We're going to start off, I want you to put your chin down, okay? And if you hold that mirror up and look in the mirror, that's not blocking, is it? All right, so put your chin down. So this is our culprit, okay? Okay, that's 62 years of birthdays, and you're in good shape. That's not fat, that's skin, okay? And there's nothing that's going to improve that other than removing that skin. Now, also, we talked about our jowls because everything comes forward and down as we age. Okay, now put your chin up. And I wish we had da-da-da music. All right, put your chin up. All right, now, this pretty much shows you what you're going to look like with a facelift, okay? And so what's happening, in reality, the skin is falling here, okay? But in reality, it's going to come off back behind your ear and your hairline, and the scar will be hidden by your hair. So it's hard to show. I think we're going to turn you this way a little bit. You can put your mirror down for a second. All right, so when we stand up, we have this square face. When we lay down and simulate the facelift, then we have this tapered face, and youthful faces are heart-shaped and tapered. So this really, when I do this and have the patient look in the mirror, and we'll take a picture with their phone frequently, this is pretty much what she's going to look like with a facelift. Now, a facelift, remember, is effective from here to here, and it doesn't do anything in this area. So it doesn't help wrinkles around the mouth. We could do laser. Her cheeks, this is kind of what she'd look like with cheek implants, but sometimes when you lay down, your cheeks actually look bigger than they would look. And, for her eyelids, lower lids would look more like that. And this is also how people will look with a brow lift. So she's not going to look like that, but when you lay down, it kind of actually simulates facelift, cheek implants, brow lift. So I think this is a really powerful way to evaluate patients, and these are the conversations that we have. So we'll be back in 1 second. So this is kind of interesting because this is not rehearsed. This actually today, she walked in, we never met before, and we started doing a consult, and I said, you know what, you would just be a good model to show people what a consult does, so I appreciate that. So some things that we normally do, and will do today because it's part of the consultation, I give everybody my cell phone and my email, okay? And again, you don't have to show that, that's all right. And again, you don't ever have to worry about contacting me or my staff. This is what we do, okay? And The other thing that's important, and I tell everybody, I'm telling you today, you're not going to figure out exactly what you want to do today, okay?
Okay.
You need to go look at my website. I have 10,000 before and after pictures. I really do. And I have over 400 videos on YouTube. And our job is to give you information. Your job is to decide what you want to do. You're going to go talk to Shelley, and she's going to give you all the details and a lot more information. And it'd be my honor to be your surgeon. And you have, you know where I live, as they say.
Right.
The other important thing is to ask the patient. And a lot of doctors don't do this because doctors do all the talking. And I'm going to do this now because we're taping this, but along the way we've already done this. What questions do you have for me?
I have done a lot of research already, and I've been to your website, and you have a great reputation. So I don't have a lot of questions right now. I've known for a long time that I was going to do this for my birthday.
Well, great, and it would be my honor. And again, I do a lot of social media. I do a lot on my website, and it's been really good because 15 years ago, and I've been doing this for a while, 15 years ago, patients would come in, and they'd have so many questions, and consults would just take a long time, and they could be confusing because after a while, you kind of get information fatigue. But with my website, YouTube, the other resources available, people study that. When they come in here, it's great. They're very informed, and we appreciate that. So thank you so much.
Thank you for
This has been probably a little unusual evaluation for you, but I really appreciate you letting us do this, and I thank my staff. And I'm Dr. Joe Nyamtu, lovethatface.com.